The purpose of this presentation is to provide employees with helpful information related to preventing and controlling COVID-19 exposure in the workplace. Today, you'll be joined by myself, Kristen Osterkamp, Senior Industrial Hygienist with MIOSHA's CET Division, and my coworker,
Audrey Carlstrom, Industrial Hygienist with MIOSHA's CET Division.
The best practice and guidance information provided in this presentation follows information and guidance provided through the CDC and OSHA as of June 8th, 2020. Employers should continue to review CDC and OSHA websites to ensure their workplace policies and procedures are based on the most up-to-date information available. During this presentation, we will provide an overview of the coronavirus and COVID-19, review employer requirements, discuss general workplace procedures, and review employee responsibilities. Overall, coronavirus is a family of viruses. SARS-CoV-2 is the specific strain of the coronavirus that causes the COVID-19 illness. In the past, other coronavirus strains have caused notable outbreaks, such as SARS and MERS. SARS and MERS also caused respiratory distress, but resulted in more regional epidemic outbreaks. The last time we have had a virus as widespread and impactful as the current SARS-CoV-2 was during the pandemic flu of 1918. Symptoms of COVID-19 typically display as pneumonia-like symptoms. People often have a fever, a dry cough, or shortness of breath. Some of the milder cases that haven't displayed those symptoms have reported instances of a new loss of taste or smell. This list does not include all possible symptoms. CDC will continue to update this list as we learn more about COVID-19. Typically, symptoms appear 2 to 14 days after being exposed to the virus. COVID-19 is spread most directly between people through close contact with individuals that are infected. Most infected individuals have symptoms, but people without symptoms may still be infected. These asymptomatic individuals are still able to transmit the virus to spread the infection. Since the primary spread of this virus is through respiratory droplets, the CDC has recommended face coverings for the public to reduce the likelihood of an individual spreading their respiratory droplets to other individuals. Wearing a face covering decreases the likelihood of transmitting the virus to others. COVID-19 may also be transmitted through contact with a contaminated surface. If a contaminated surface is touched, and then the individual subsequently touches their eyes, nose, or mouth, that individual may then become infected with the virus.
In this next section, we will review employer requirements. As part of returning to work, employers have to develop procedures related to the topics listed on this slide. For example, an employer will have to develop an exposure control plan that includes conducting an exposure determination of the task or work activities employees perform and determining what risk hazard category these tasks or activities fall into. Hygiene and disinfecting procedures must include basic hygiene, hand washing, the use of hand sanitizer, and how to isolate and disinfect an area. Employers should report positive COVID-19 cases to public health officials as required, and it is recommended to notify employees of potential exposure. Engineering controls that an employer can implement may include installing plexiglass barriers between employee workstations. Administrative controls must support the CDC's social distancing guidelines. Examples include moving machines or workstations, lowering occupancy rates, spreading shifts out, and conducting health screening procedures. What PPE or personal protective equipment is provided and required will be determined by the employer's exposure determination for the respective task or work activities being performed. Employee training will include information on the coronavirus, how it spreads, and proper hygiene etiquette. Your employer is required to conduct a hazard assessment to determine which exposure risk category your workplace activities and job tasks fall into. OSHA created the exposure risk categories noted on the slide to assist employers in identifying applicable risk categories for their respective work activities and job tasks. Most industries outside of healthcare, emergency responders, and correction or police officers will probably fall into the medium and lower risk hazard categories. As with any other workplace hazard, we always want to follow the hierarchy of controls. This graphic illustrates the hierarchy of controls from most effective to least effective. In regard to controlling exposure to the coronavirus, we should not jump straight to PPE and must first implement engineering and administrative controls. Examples of potential engineering and administrative controls listed on the slide may now be implemented and required in your workplace. After considering engineering and administrative controls, we then turn to selecting PPE. Employers will decide what PPE is required based on the identified exposure risk level. The higher the risk, the higher the level of PPE will be required. Healthcare, emergency responders, and correction or police officers typically are in the very high and high risk groups. Tasks performed in most other industries will fall into the medium to lower exposure risk groups. PPE for medium risk exposure tasks will be based on the task-specific hazard. An employer may make it mandatory for customers to wear a mask in order to enter their facility. Lower risk exposure tasks will not require additional PPE beyond what is typically used for job tasks. The use of masks, face coverings, or respirators is voluntary when social distancing is possible. The CDC currently recommends face coverings for everyone in public. Employers should encourage face coverings, especially when employees are using public transit to get to and from the workplace. There is a significant difference between face coverings, homemade face masks, and NIOSH certified respirators, often referred to as the N95s. This fact sheet explains the protection provided by each type of mask. If a respirator is used, then the respiratory protection standard applies. This table highlights which sections of the standard apply based on if a respirator is required or voluntarily worn. It is the employer's responsibility to train their employees on policy changes, new procedures, and implemented workplace controls. These controls are only effective if employees are adequately trained and are using them as designed. Employees should be trained on workplace controls such as those listed on this slide.
In this next section, we will be discussing general workplace procedures that are applicable to a variety of facilities. OSHA has published 10 steps all workplaces can take to reduce the risk of exposure to coronavirus in the workplace. Generally speaking, these guidelines recommend sick employees stay home, regularly cleaning the workplace and used equipment, and establishing new policies to reduce the number of employees on site at the same time. Workplaces are expected to implement cleaning and disinfecting procedures. It is important to understand that cleaning and disinfecting are different. Cleaning refers to the removal of germs, dirt, and impurities from surfaces. It does not kill germs, but removes them through the use of soap and water. Disinfecting refers to using chemicals to kill germs on surfaces. This process does not necessarily clean dirty surfaces or remove germs, but kills germs on a surface after cleaning. The EPA has listed a number of disinfectants registered on List N approved for the use against the coronavirus. Some of the most common disinfectants for coronavirus include a bleach solution consisting of 1/3 cup bleach per gallon of water or 4 teaspoons of bleach per quart of water. A 70% alcohol solution may also be used. This could be used in a pre-soaked wipe or in a liquid form. Notice this is a different percent alcohol when compared to hand sanitizers. Hand sanitizers must contain at least 60% alcohol, whereas surface disinfectants must contain at least 70% alcohol. Another option would be to use other commercially available disinfectants. Here are a few common products from the EPA's registered disinfectants list. The list can be viewed on the EPA website. It is important to always follow the manufacturer's directions for use of any cleaning or disinfecting product. Many people understand the need to stay home when they are sick and have symptoms of COVID-19 or have a positive test result. When to stop isolation and return to work can be a more difficult decision. The decision to discontinue home isolation should be made in consultation with your healthcare provider and state and local health departments. Currently, the CDC has these recommendations to guide return to work decisions. There are guidelines for multiple scenarios, test-based and non-test-based strategies. For the non-test-based strategy, an individual with symptoms of COVID-19 who is directed to care for themselves at home may discontinue isolation under the following conditions. The individual must have had at least 3 full days without fever, without the use of fever-reducing medications, and have shown improvement in respiratory symptoms, cough, shortness of breath, and at least 10 days must have passed since symptoms first appeared. Please go to the CDC webpage for the most current guidelines and recommendations on COVID-19.
Next, we want to discuss what employees can do to protect themselves and reduce their risk of exposure and slow the spread of the coronavirus as we return to the workplace. The President has published a short fact sheet and information guide for the public. These are considerations that you can apply throughout your day and at the workplace. The best way to protect yourself from COVID-19 is to know how the virus spreads. Primarily person-to-person contact and contact with respiratory droplets are thought to be the most common ways the virus spreads. This is why it's important to avoid close contact with others. CDC has tips for social distancing on their website. As a general rule, try to maintain a 6-foot distance from others. This is approximately 2 arms lengths. The use of cloth face masks to cover your mouth and nose helps to prevent the spread of respiratory droplets from yourself to others. You should wash your hands often and thoroughly and cover your coughs and sneezes with a tissue or with your upper arm. The proper wear, use, and maintenance of cloth face coverings is important. Cloth face coverings should fit snugly but comfortably against the face, be secured with ties or ear loops, include multiple layers of fabric, allow for breathing without restriction, and be able to be laundered and machine dried without damage or change to shape. The CDC recommends wearing cloth face coverings in the public settings where other social distancing measures are difficult to maintain, like at the grocery store or pharmacies. The cloth face coverings recommended are to prevent the spread of respiratory droplets of the wearer and are not surgical mask or N95 respirators. Cloth face coverings should be washed regularly to maintain cleanliness. Individuals can be exposed to the coronavirus through touching contaminated surfaces and then touching their eyes, nose, or mouth with unwashed hands. It is important to regularly wash your hands with soap and water for at least 20 seconds. The use of hand sanitizer that is at least 60% alcohol is recommended when soap and water are not available. Always cover your nose and mouth when coughing or sneezing with a tissue. If a tissue is not available, use your upper arm to cover your nose and mouth. After coughing or sneezing, wash your hands. Hand washing is one of the most effective methods to reduce the spread of any virus. All workers have the right to raise safety and health concerns with their employers or with MIOSHA. Employees are protected against retaliation when raising safety and health concerns. If you believe your employer is not providing a safe and healthy work environment, please go to MIOSHA's webpage for more information on filing a complaint. Various entities have published guidance for specific industries. Please look to these websites to see if there's guidance for your specific industry. MIOSHA offers a variety of tools and resources. The MIOSHA Consultation, Education, and Training Division provides training and consultation services. You can request a consultation by filling out the Request for Consultative Assistance form online or by calling the CET office. On our webpage, we have all our standards available, as well as standard program guides and sample written programs like those needed for PPE, respiratory protection, and hazard communication. Throughout the year, we also have a number of training courses available around the state. Here is a list of resources specific to the COVID-19 response. The state of Michigan, MIOSHA, federal OSHA, and the CDC have published a wealth of information for employers and employees. Please go to these websites for the most current information on COVID-19. Thank you for viewing this training. If you need any additional information, please contact MIOSHA.